The pressure has been building over several days now. And today, Governor Charlie Baker announced with hospitalizations up by 150% and the number of ICU patients increasing by 110% in the past 4 weeks, the time has come for tighter restrictions.
The days of most people doing most of the right things are probably not enough. With our hospital system straining to keep up with the sharp increase in severely ill patients, we have to do more. And effective this Sunday, the Commonwealth will move every community in Massachusetts back to Phase 3, Step 1. We're also reducing capacity limits to 40% statewide for pretty much everything else.
So on top of the new 40% capacity limit, the rollback to Phase 3, Step 1 means indoor theaters and performance venues and high-contact indoor recreational facilities such as roller rinks, obstacle courses, laser tag, whatever that is, will close entirely. Additionally, outdoor gatherings will be limited to 50 people. Any groups over 25 will have to notify the local Board of Health. And face masks will now be required at all times in all gyms and offices unless someone is in his or her own personal space or has a medical condition. Restaurants, too, will have new rules with a maximum number allowed at a table dropping back down to 6, plus a 90-minute seating limit. Masks will also be required of everyone at all times except when eating or drinking. Officials are also urging people to only dine with members of their own household, although that's just a recommendation, not a rule. And once again today, the governor repeated his constant plea for personal responsibility.
Try to take advantage of the guidance. Don't spend a lot of time in indoor spaces with people you don't live with. Don't go to a friend or a neighbor's house without a mask on and share food and drink just because they're your friend.
The governor also reminded everyone that unemployment benefits are running out for many people at the end of the month and fought back against criticism that he's taken too long to roll back reopenings.
And there's no question that some of the decisions that we're making today that will become effective this weekend will create hardship and difficulty for many small businesses and their families, which is why these decisions are hard. These decisions might seem easy to some people who don't have to live with them, but they don't feel that easy to the people that do. And we should never forget that.
But more than a dozen town and city leaders argue there can be a middle ground. Writing in a Commonwealth Magazine piece yesterday, we do not have to accept the false choice between protecting people's lives and protecting their livelihoods. I'm joined now by two of the co-authors of that piece, Somerville Mayor Joe Curtatone and Framingham Mayor Yvonne Spicer. And welcome to both of you. But before we begin, when we do segments where a guest is critical of Governor Baker's policies, and they may be tonight, some of you write in and ask why we don't invite his administration to respond. Actually, we do. Since the beginning of the pandemic, we've reached out for an interview with the governor 12 times, his public health commissioner at least 17 times, and his health secretary at least 20 times with a handful of follow-ups. All requests have either been declined or ignored. Mayor and Mayor, good to see you both. Thanks so much for being here.
Thanks for having us, Jim. Hello, Mayor.
I want to quote, if I can, Mayor Spicer, starting with you, that letter signed by you and a dozen other local leaders says to mitigate human suffering, this will require targeted temporary rollbacks of the state's reopening plan with a focus on reducing activities that are sources of transmission, especially those that allow for gatherings of people from outside our households. That's what the governor did today. You are now in a red zone in Framingham. Did the governor do enough, Mayor Spicer?
You know, right now, I have been evaluating where we are and where we need to go as a community. And once again, as I consistently believe, is that we've been doing the same thing and we've got to do something a little different. And I certainly appreciate the effort to try to do something different. And let's evaluate it and see where we are. And is it having an impact?
Mayor Curtatone, did Governor Baker today do enough?
Thanks, Jim. Well, I appreciate the fact that the governor seems to have listened to many of us and our personal pleas. No, I don't believe so. I mean, these are less than incremental steps. For example, we never went to the full extent of 3.1 that he just rolled back to. Many communities around me followed the same suit. I speak for a lot of my colleagues. We believe there should be a targeted temporary rollback to an adjusted phase 2A of the reopening plan. Pause in many of those activities that were indoor maskless or high-risk activities like indoor dining and health and fitness centers. So in the face of a pandemic that's overrunning us, baby steps aren't going to do it. We need to be deliberate, definitive, and then we need to support those businesses financially that are being impacted and their employees.
I want to get to the financial support for a minute, but it seems that the governor anticipated your criticism from a minute ago when he was asked today about, he talked about some communities never reaching phase 3, step 2. He was asked, would you encourage any of those leaders to consider rolling back further on their own? And here's what the governor said.
We've said all along that locals can make decisions, that they think the data on the ground justifies doing more than something we've proposed. They should feel free to do that. And we talk to them all the time about this stuff.
You've done that, Mayor Curtatone. I believe you've done that too in Framingham, Mayor Spicer. Mayor Curtatone, starting with you. Why isn't that enough? You've got the power. Do it yourself.
As we wrote in the op-ed, first of all, I find those disappointing, that comments, because you made clear the beginning of the pandemic when we all had to move quickly. Community leaders like myself, Mayor Spicer, across the Commonwealth moved to close schools, issue stay-at-home advisories, take other measures to keep people safe. Now we find ourselves in a position we can't do it alone. To have the health impact we want to save lives, we need to collectively at a regional level minimally. We need the support of the Commonwealth, and we need the resources to assist those businesses that are being impacted and employees. And you know what? We've been on it our own. The governor's told us have at it if you want to do it. That's not going to work. We need bold, deliberate, collaborative leadership to help us along the way. We've seen this not working. The resurgence is upon us. And even with our schools, we've had to devise our own plans and approaches. We really need that partnership and leadership from the governor's office. No municipality can do it on their own. Yeah. It's not going to work. It's not going to work unless we have a broad enough swath of the geography to have an impact.
Mayor Spicer, you saw the letter you all signed said rollback measures was intimated by Mayor Curtatone must be coupled with relief like places like Rhode Island, California. You're both Democrats, and Democrats in the state have not been hesitant to criticize Republicans in Washington for stopping any relief for the American people and small businesses. The Democrats control Beacon Hill. They could pass anything and override any Governor Baker veto. Why isn't criticism being directed at the Democrats on Beacon Hill? The governor did something on eviction relief. People think not enough. There was something for small businesses also done by the governor. Why isn't criticism being directed at the Democratic legislature?
You know, it's not about hurling criticism either way. It's really about everybody rolling their sleeves up and tackling this problem together. This is not a red state, a blue state issue, a Democrat, Republican issue. It is a United States of America pandemic that is wreaking havoc on this nation. And we need to figure out ways that we can work on this together. Some of the targeted assistance, I mean, if we're going to close businesses, we need to provide some relief for them in order to open. The same thing we have been pushing, both Mayor Curtatone and myself, as well as other mayors of Walsh and so forth, that have been pushing even at the national level to get relief coming forth. So it's all of us working at this together.
Yeah, and
can you say, go ahead, Mayor Curtatone.
No, I just say we're not fighting the legislature. We're not fighting the governor. We need to work together. We're not fighting the businesses, the economy, or parents who want to send their kids back to school. We're fighting the pandemic. And there's no balance of we are trying to save lives. You don't have to accept, as we wrote, that false choice of making a dollar and giving up a life. We can do this. New Mexico has, what, the 47th ranked economy in the nation? And they passed a relief bill of $330 million. I think we can do something here in Massachusetts. We're smart and we have the right value set. We have to act by it. And as the mayor said, we want to work with the legislature and the governor to make this happen. They did some really important work already on this, passing more than $50 million in direct money and relief dollars. But we need to have more given what we're faced with right now and Washington not acting.
You know, my understanding, Mayor Curtatone, is the Somerville schools have been closed to in-person learning since March. Correct me if I'm wrong. And I think correct. You in Framingham, Mayor Spicer, went back to remote learning on Monday, if I'm right. The governor and the Education Commissioner Riley have said that the data suggests and the science suggests it is safe, particularly for young kids, to have in-person learning. Where are they wrong?
If I may add, well, the data
let me
just
start
showed
with
the younger
Mayor
kids.
Spicer. Let me
I'm
start with
sorry.
Mayor Spicer if I can.
My
That's okay.
apologies.
Mayor Spicer. Are they?
I will say that, first of all, I'm in close contact with our superintendent on a regular basis, and we look at the data. We look at the data, and right now we've rolled back to just having our high need students, a small number of our high students in school, and we've had to roll that back due to community spread that is coming into the school. So we're trying to err on the side of caution as best we can, but we've also prepared ourselves to be able to pivot when we need to back to remote learning because of the resources that we've provided for the school department. So that was our decision is based on our data that is happening in Framingham.
How about you, Mayor Curtatone? You're not a red zone community, from what I understand. You're a yellow zone.
No, but our cases are not just moving in the wrong direction; they're accelerating like every community now. And let me just say this: while it is true, evidence shows that the younger the kids are below age of 10, there's less of a risk of transmission. However, what we've seen around the world and the lessons that we learned in this short but intense crisis is the details matter when it comes to opening schools. The mayor just mentioned it. Community spread must be under control. And I ask you, is it under control? In addition, much like we didn't have a plan to work collectively, even regionally, to take on the pandemic, the Department of Early and Secondary Education and the Commissioner or the Governor put forth a plan for schools. They left it upon us to figure it out, and we made it clear. Experts have said in-person learning is high risk. The incoming president and vice president made it a priority to get money for school districts to deal with air filtration issues and do surveillance testing. We've asked that of the administration. Our plan involves, like many other municipalities, working together and sharing these practices to upgrade our air filtration systems so we have safe environmental systems in our schools to lessen the risk of transmission, to conduct surveillance testing. We announced a new pool testing approach with Tufts University, the City of Medford, and the Braude Institute. And the major thing, because the details matter, Jim, is we've got to reverse the trend of community spread. And I submit the actions taken today are at best incremental, probably less, and that's not going to do it. We don't have time to reduce community spread.
We only have a minute left, and I want to broach one more thing with both of you. Obviously, the end of the rainbow, we hope, or at least close to the end of the rainbow, is the vaccine. Starting with you, Mayor Curtatone, you and Mayor Driscoll of Salem, I heard on a GBH report, have offered to take the vaccine publicly when it's your turn. Very quickly, the reason for that, I assume, is to send a message to people who are vaccine hesitant in your communities? Quickly, please. Absolutely.
We need to set the tone and the example that's serious in the vaccine. We know scientists are saying, experts saying it work. We should take it and set the tone and set the example.
And Mayor Spicer, you've evinced some hesitancy, and I don't think anybody will be surprised considering the history of racism in medicine directed at people of color, particularly black people in this country. But do you worry about what message that sends to other people of color in your community who are also vaccine hesitant?
The one thing I will say, we have got to build trust within our communities, and particularly communities of color, about this vaccine. I certainly believe in the science, and if the science is saying this is a good vaccine, I will take it. But I also know that it will require some work within our communities of color, definitely. And it's largely due to the history of being experimented on. So we have our work to do.
You have the hardest work to do, and I wish you both luck. Mayor Spicer of Framingham, Mayor Curtatone of Somerville, thank you so much for giving us some of your time. We appreciate it.
Thanks, Jim. Thanks, Mayor.
Thank you, Mayor. Good to see you.